let's just meet, so you have like 30 seconds before the AG comes in.
Last day of the most miserable month. Oh, we can.
Good morning.
Good morning. Hi. Great. Thank you all for coming. I'll just walk through the process, although you're all familiar with it. The Auditor General will have a prepared statement of about 7 minutes long, and then we'll open the room to questions. And now I'll turn it over to Auditor General Kim Adair.
Okay, thanks Amy, and good morning everyone. So this morning I filed a new report with the House of Assembly, an audit of alternative procurement and management of selected health contracts. We chose to do this audit given Nova Scotia Health's practice of sole sourcing health contracts. There have been billions of dollars in high-value alternative procurement, also referred to as ALT-P, contracts. This audit builds on issues raised in our recent financial reports, as well as a performance report we did on the value for money of the development of transitional care facilities. Before I get into the findings, I would like to acknowledge Nova Scotia Health is operating in a challenging and complex environment and under significant pressure to find solutions to deliver province-wide health care. However, the established procurement rules outline a competitive process is required for any procurement valued at over $25,000. But the rules do allow for exceptions in urgent, specialized, or exceptional circumstances. Testing for this audit of 6 sole-sourced health contracts shows Nova Scotia Health is inappropriately using ALT-P and not following provincial policy. For 5 of the 6 vendors in our sample, the vendor was awarded the contract before the use of the ALT-P was properly approved by senior management. Our audit testing reveals that weak rationale was used to justify the use of ALT-P for 4 of the 6 vendors examined. In some cases, the scope and value of the work was later significantly expanded. The lack of competitive bidding makes it challenging to objectively determine the most qualified vendor and most reasonable cost. Alternative procurement reduces competition and public transparency and potentially discriminates against vendors while increasing government reliance on a single vendor. Alternative procurement must only be used when specific circumstances are met, such as only one vendor can provide what is required, in emergencies, or to maintain compatibility with existing products. Nova Scotia Health might need to act quickly to address challenges facing the province's healthcare system, but expediency should not take priority over appropriate due diligence, nor does it justify non-compliance with procurement policy. On a more positive note, once the sole source contracts were awarded, our audit found the contract work was subject to regular monitoring, but improvements are needed to ensure the vendors deliver. The audit makes 13 recommendations, which Nova Scotia Health has accepted and agreed to implement, with some of them already underway. Starting in 2 years, we'll check back to see if it's followed through on the plan. That's the normal process for follow-up by my office, and that leads me to the other report filed this morning. I also tabled our annual follow-up report, which checks back on government's implementation of the recommendations by my office. Every year, my office conducts several performance audits of government organizations, like the health contracts audit released today. In every report, we identify opportunities for improvement by making recommendations. Between 2021 and 2023, the 3-year total of recommendations made in performance audits was 115. The government has agreed to complete all AG recommendations within a 2-year time frame. Every year we circle back to assess government's implementation rate. In this annual follow-up report, it's a process that started back in the early 2000s. This year, I'm happy to report government has completed 83% of the recommendations from the 3 years looked at in this year's engagement. That's up over last year's score of 80% and way up from the 60% rate the year before that. The government's commitment to carrying out the recommendations shows it values the work of the office and our recommendations. However, there are a few recommendations still not completed, including Health and Wellness has not completed its own quarterly assessment of emergency medical care incorporated performance against ground ambulance standards. And it has not introduced financial penalties for failing to meet medical performance standards. The Office of the Fire Marshal has not implemented a fire safety complaint tracking and resolution process, and it's not regularly updating building inspection listings for completeness and accuracy. In addition, Cybersecurity and Digital Solutions has not completed the work required to address our technical weaknesses identified in our audit of cybersecurity readiness in healthcare. So I strongly encourage these departments and all organizations to work toward timely completion of every recommendation to improve efficiency and effectiveness of government programs and services. If these remain incomplete, significant risk and serious issues will go unaddressed. As always, I'd like to thank my staff for their efforts in producing this report. We begin this effort of follow-up in the fall, and it takes several months to check in, confirm, and assess that the recommendations are completed. Also, my thanks to many public servants across government and Crown corporations who are key to our ability to do this work. So now I'd be happy to take any questions.
I'm wondering, Ms. Adair, is there any way to find out how much money the government may have overpaid because of its reliance on alternative procurement in these cases?
Is there any way to find that out? I would say yes, a couple of ways. But the focus of today's audit was on the procurement practices of Nova Scotia Health. And then once they procured these sole source contracts, did they then manage them to make sure the vendors delivered based on what the contract terms were? Did they have KPIs? Did they have measurable deliverables? The value for money part of it, which I think is what your question is focused on, is an audit in itself for each and every one of these contracts. Some of them are underway. We would assess value for money usually after the fact. Good example is the transitional care facility. It's early days for that potentially 35-year contract. One building is open, the second building is about to open. At some point in time, I would expect we will go back and assess the value for money. There is good information in here about the first year of operations though, in terms of roughly 400 patients have come and gone from the transitional care facility. The average length of stay is around 45 days as opposed to the objective of 28. So there is some good information for the public to assess, but we did not weigh in on the value for money in this audit.
Is there any work underway by your office on value for money related to any all procurement in healthcare?
So I would have to run down the list of projects underway. None come to mind, but I would point out that the first recommendation in this report is important that Nova Scotia Health justify why they're sole sourcing and indicate that they're getting best value. So it's really Nova Scotia Health's responsibility to demonstrate that, and they should do that.
So there's a big number here, 3.7 billion since 2020.
Yeah.
How much of the contracts awarded by Nova Scotia Health are going through all procurement?
So there's a chart, 5-year chart that shows the practice in recent years. That the 3.7, there's one that's particularly large in the mix, right?
Right.
And that's the transitional care facilities at potentially 35 years, and we point that out. It's inflation factored in. The number of 2.7 was indicated by Nova Scotia Health. But if you look at the table and the percentage of LP practice in recent years, it has grown. And that's one of the reasons we went in to look at these.
So really, it looked, looking at that chart, it looked like a very significant part of the contracting by Nova Scotia Health is sole source, that's correct, isn't it?
A significant portion, yes. Yeah, these are the high dollar. They have a lot of under 25,000 each and every year, so it doesn't capture that group. But yeah.
Ms. Adair, for the average Nova Scotian who isn't keeping on top of what's going on in the contracts happening, why should people care about the use of alternative procurement, and what concerns may they have about it?
Well, it's unfair competition to the vendors. I mean, the reason you have the procurement policy and the legislation is to have an open, fair, and transparent process. There's things, just to point out, like one of the concerns in particular is the scope creep. It can start small and grow very big. And there were two that we can cite. That one was for like vendor 5 consulting services. It started out at 1.2 million, and over the 5-year period, it was in the range of 37 million. So there's successive work orders, not always related to previous work, where that one consultant got all that work. Why weren't other consultants given the opportunity to deliver or to participate? Vendor 4, the virtual care contract, started out as a pilot project, around 300,000 in 2 areas of the province. Successive renewals of that arrangement ended up in being a $63 million contract, never went to public tender. It is good that right now there is an RFP process underway for virtual care, so that's positive. But why it didn't happen in the first place is not clear.
To Lindsay's first question, is there evidence through this audit process that's showing that relying on this alternative procurement process is costing taxpayers more money?
So we didn't do that exercise, but if you don't go to public tender, you don't have the different prices coming in to make that judgment call. How can you objectively determine whether or not that's happening?
So a follow-up to that one then, I guess. Given that Nova Scotia Health is saying they want to, hit the ground, this, I guess, speed,
Yeah.
Rolling it out is a major factor in this. In your audit, does it show that factor is relevant, or are there contracts here that have gone out that didn't really need the speed or the fitness that Nova Scotia Health is seeking in this, or say there?
So we do acknowledge that there is a very complex, fast-moving, they're trying to transform healthcare under significant pressure to deliver and deliver fast. But the procurement legislation is in place and they do need to follow it. Expediency should not override due diligence and compliance with the policy and the legislation. That's our overriding message.
Is the government showing the care with public money that you would expect?
So that would be something I could answer only if we did the value for money exercise. Although I would say I'm surprised at the extent to which sole sourcing of the contracts was taking place. And when we show in this report that 4 of the 6, we couldn't find the justification to support, it certainly calls into question that very thing.
The Nova Scotia Health has issued a statement responding to your report, and it says that the report found no real or perceived conflicts of interest.
Mm-hmm.
Would you agree with that statement?
So we do state that in the report. What we do point out when it comes to conflict of interest, I'll just articulate it a bit, is the process when you go LP is not as stringent when it comes to conflict of interest practices compared to an RFP process. For example, an RFP, all of the employees involved are required to sign an individual declaration that there's no conflict. That doesn't happen in the alt-P scenario. So we made some recommendations to strengthen it for alt-Ps. The other conflict of interest concern we cite is in regard to the Innovation Hub. I'm not sure if you're aware of the Innovation Hub. No issue with the concept of this sort of gathering point of healthcare providers to brainstorm ways to transform the healthcare system. All of that's good. What we call into question is how they're funding it. So they have funding Innovation Hub partners, and they pay a certain amount each year to participate in the hub. And then there's the appearance of conflict if in fact they turn around and give big contracts to these partners, especially if they're sole source contracts. So that was the issue around conflict of interest. We've made a recommendation that they look at the funding strategy for the Innovation Hub because of the potential for a perceived conflict of interest.
It almost looks like toll gating to me, you know.
Toll gating.
Where people, you know, companies are paying to get through the door, and then once they're in the club, they get contracts.
So that's the very point, is the perception. And in a government setting, you can't have that type of an arrangement and not be questioned on, was there a conflict there?
Do they have those safeguards in place now?
No, and that's one of the recommendations, that we're saying there should be a lot more safeguards around the Innovation Hub in particular because of the way it's structured.
Ms. Adair, what did you think about the instances where contracts were not approved by the provincial department, and yet the health authority, or the approach I should say, was not authorized by the provincial department, and yet the health authority went ahead and did it anyway?
Yeah, so it's an interesting thing about the policy and the rules that even though procurement looks at it and decides whether or not they feel it fits the purpose of LP, Nova Scotia Health or a department can still proceed as long as they can justify it, right? And that's why the most senior person in the organization is the one that signs off, which we didn't find until after the fact. And there was one in our 6, which was the consulting services, where Service Nova Scotia, the procurement group, did not support that as an LP, but Nova Scotia Health chose to proceed regardless.
Do you think this is a scenario that highlights perhaps the shortcoming of an organization of this size not having a board?
So that's another interesting point. We do weigh in on the fact that given the nature of these 6 contracts, some of them the dollar value, the fact that they were all different specialized services, so we've got everything from the transitional care facility, over $2 billion. There's virtual care, there's the chat tools. These are all unique initiatives that one would have thought, if there was a fully functioning board, and there is, right now, as we know, a sole administrator who, in our eyes, functions like the full-fledged board, should have and could have been a participant in the decision to LP, because there is a risk whenever an organization goes and does a specialized arrangement, which is, you know, allowed under the policy, but we do weigh in this report that we would have anticipated or expected that the administrator had been involved, and found that the administrator was not informed of any of these, but we've got a recommendation around that going forward as well.
You mentioned that in this piece about the contract weaknesses noted, one vendor with no contract. Can you help me understand what that means?
Yes, so that was vendor 6, and the service was around integration of international nurses. What we found is that there was no contract. It was one of the smaller dollar values. The piece that we looked at in detail was $150,000. There was limited evidence of the work that they did, and we found that they were paid before the alternative procurement was approved. We did, for that vendor, look at other pieces that they were contracted to work it, and it is in the report. It's to the tune of another $1.5 million. We didn't look at it in as much detail, but we did have similar concerns. So it's very concerning that you have work being done, no contract, not much to show at the end of the day as to what they did. We were told that they did things, and there was meetings that went underway, but there was no final report, there was no recommendations. That should not happen.
You also pointed out, I think, some concerns about the free trade the exemption under the Canada Free Trade Agreement.
Mm.
Concerns going forward because those rules have changed. Do you want to
Sure.
talk a little bit more about that?
So, under the LP rules, there's a list of categories that are considered appropriate to sole source. As we were doing our work, there were changes made to that list. Canada Free Trade Agreement, Health and Social Services exemption is what it's called, now qualifies as justification to sole source. What I cite in the report is I find that concerning, because potentially millions, possibly billions of dollars can fall under health and social services exemption. The other important piece is that, and this is leaving Nova Scotia Health for a minute, over to Service Nova Scotia, the procurement group. They're the ones responsible for posting these contracts on the government portal. They've chosen, when it's a Canada Free Trade, Health and Social Services exemption, to not post them on the portal. So there's a transparency issue. So I think what is said in the report is we strongly encourage that they reconsider and post anything that falls under that exemption to the portal.
Potentially could the, so just on that point, potentially could the exemption be used for any of these contracts? They're all health contracts.
Well, that's a good question. It's early days, and that's a very good question to ask folks, and it was done as a policy change, so it would have, I'm not sure what the approval process was to change that.
Was it a provincial change or a federal change?
Provincial.
Do you know
Provincial to add it as a exemption for an alternative procurement.
Do you know if the lack of disclosure around the free trade provision is unique to Nova Scotia, or do other provinces do that too?
I don't know right offhand, yeah.
Thanks.
Okay, thank you everyone.
Thank you.
Okay, thank you very much. We'll be back in May for a few other reports if you want to check our website to follow along. And if you want to use the room for a scrum for opposition,